There's a biologic also in development.
Absolutely.
What can we say about that?
Sure. So the biologic right now that is in development is a medication called crizanlizumab, which is being made by Novartis. Crizanlizumab is just starting their phase 3 trials now, but the phase 2 trials showed quite a significant reduction in vaso-occlusive episodes. And the way that crizanlizumab works basically is that it targets basically adhesion molecules, which we call selectins, in particular P-selectin, which is almost like a scaffold on endothelium. It's like a magnet on endothelium that attracts white blood cells, and it also is expressed on platelets. And as we discussed earlier, the vaso-occlusion is very multifaceted in the players that contribute to the occlusion. So this monoclonal antibody was developed, and like we were discussing in the phase 2 trial, showed a tremendous reduction in just under 100 patients. Again, randomized controlled trial, placebo-controlled. They showed that not only did they reduce the amount of pain, they also significantly reduced the time to the first pain crisis and the time to the second pain crisis. So it's quite an exciting molecule.
Oh, is that in addition to the standard of care they were already on?
Correct. So about 2/3 of those patients were on hydroxyurea.
Okay. And where would you anticipate the use of this in a practice setting?
So this is a molecule that is being explored as a prophylaxis. So this is a infusion that patients would get once a month. For several doses to prevent pain from coming. And I think that is a very interesting component, because it puts the adherence issue sort of off the table, because this is something patients have to come into the clinic to receive an infusion or to an infusion center. And that takes away the daily sort of, to have to open a bottle and take a pill.
So also in our discussion here, looking at what's coming down, there was the recent RESET trial.
That's right.
And could you talk a little bit about, what was involved in that?
Sure. So, the RESET trial is a molecule, explored the efficacy of a molecule called rivipansel, which was a pan-selectin inhibitor. So again, focusing on the adhesion molecules that sort of work as magnets to pull together these components of vaso-occlusion. And that molecule was being trialed in patients who were having pain inpatient. So it was an infusion for patients that were admitted in the setting of pain who were getting opioids. In the phase 2 trial, what they looked at was basically the time it took for readiness to discharge. And they also looked at the cumulative opioid use. The phase 2 trial showed trends that looked favorable, but not necessarily statistically significant. They tried to address that in the phase 3 trial, and just recently we found out that they were unable to meet their primary endpoint in the phase 3 trial. So hopefully we'll get more information about sort of where we went wrong with rivipansel.
Okay, and my understanding is there's one other drug in the pipeline that's getting a little bit of attention.
Yeah, absolutely. So we discussed a little bit about the role that platelets may play in vaso-occlusion, and people started investigating the role of antiplatelet therapy. So the current medication being sort of examined by AstraZeneca is a medication called ticagrelor. And this is a medication often used in patients with coronary artery disease, and works by essentially inhibiting ADP-mediated platelet aggregation. So this trial is also going now into a phase 3 with some promising phase 2 results. We have had an antiplatelet agent that was assessed in what we called the DOVE trial, and this was called prasugrel. And prasugrel was unable to achieve the meeting of endpoints in its trial. We hope that we have a different result with ticagrelor.